In today's fast-paced and stressful world, it's more important than ever to stay healthy. Even though we care more about our health than ever before, there are still many common health problems that can happen to anyone, no matter their age, gender, or way of life. These health problems can be either long-term or short-term, and they can have a big effect on a person's quality of life. Here are the top 10 most common health issues. Number 10. Obesity. Obesity is a condition in which a person has excess body fat, which can lead to a variety of health problems such as heart disease, diabetes, and high blood pressure. Obesity is a disorder that can be caused by a genetic predisposition. In most cases, obesity is brought on by a confluence of hereditary, environmental, and lifestyle variables. These factors include a poor diet and a lack of regular physical activity, modifications to one's diet, increased levels of physical activity, and, in extreme circumstances, either medication or surgical intervention may be necessary in order to treat obesity. Number 9. Mental health. Concerns relating to one's mental health, such as stress, worry, and depression, are also among the most frequently encountered medical problems. These problems may have their roots in a wide range of causes, including heredity, the stresses of daily living, and the conditions of the surrounding environment. Changes in lifestyle, including methods of stress management and self-care routines, as well as psychotherapy and medication, may be part of the treatment plan for mental health conditions. Number 8. Diabetes. Diabetes is a condition in which the body is unable to manage blood sugar levels in an appropriate manner. Diabetes is referred to as the sugar disease. A variety of factors, including as genetics, nutrition, and lifestyle choices, can all play a role in its development. Diabetes type 2 is more prevalent and is frequently associated with being overweight as well as having a sedentary lifestyle. Alterations to one's diet, increased levels of physical activity, and the use of medication are often all components of diabetes treatment. Number 7. Heart disease. Heart disease is a disorder in which the heart is unable to function correctly owing to injury or other reasons. Heart disease is also known as coronary artery disease. Cigarette smoking, high blood pressure, high cholesterol levels, and diabetes are all risk factors for coronary heart disease. Medication, alterations to one's lifestyle, and even surgery are all potential treatments for cardiovascular disease. Number 6. Arthritis. Arthritis is a disorder that produces inflammation in the joints, which ultimately results in pain and stiffness in the affected joint. A wide range of factors, such as genetics, age, and trauma, have been implicated in its development. The treatment for arthritis often consists of taking medication, going to physical therapy, and making adjustments to one's lifestyle, such as exercising more and watching one's weight. Number 5. Cancer. Cancer refers to a group of diseases that are characterized by the proliferation of abnormal cells and have the potential to spread to other areas of the body. A person's genes, their environments such as their exposure to chemicals, and their lifestyle choices such as smoking and eating poorly can all be contributors to their likelihood of developing cancer. Surgery, chemotherapy, radiation therapy, and other treatments including immunotherapy are some of the options that may be used in the treatment of cancer. Number 4. Respiratory diseases. Disorders of the respiratory tract. Respiratory diseases, such as asthma and chronic obstructive pulmonary disease, also known as COPD, are frequent health problems that can impact a person's ability to breathe and their lung function. Genetics, environmental factors such as air pollution, and lifestyle variables such as smoking are all potential contributors to the development of respiratory disorders. Alterations to one's lifestyle, such as avoiding triggers and improving air quality, can be used in conjunction with medication and oxygen therapy as a treatment for respiratory disorders. Number 3. Alzheimer's disease. It is a degenerative brain ailment that interferes with a person's ability to remember, think, and behave normally. Genetics, age, and variables related to lifestyles, such as an unhealthy diet and a lack of physical activity, are all potential risk factors for Alzheimer's disease. Medication and adjustments to lifestyle, such as increased physical activity and cognitive therapy, are both potential components of a treatment plan for Alzheimer's disease. Number 2. Kidney disease. When the kidneys are harmed and unable to function correctly, the illness is referred to as renal disease. Filtering waste and extra fluid from the blood, controlling blood pressure, and generating hormones that encourage the creation of red blood cells are all important functions of the kidneys. Waste products can accumulate in the body and cause a number of health issues when the kidneys are damaged. Number 1. Stroke. A stroke is a medical emergency that occurs when blood flow to the brain is disrupted, resulting to damage or death of brain cells. A stroke can also be referred to as a cerebrovascular accident. High blood pressure, smoking, and diabetes are all potential contributors to the risk of having a stroke. Stroke treatment options include medication, surgery, and making adjustments to one's lifestyle, such as increasing one's nutrition and level of physical activity. What do you think of our video? Let me know in the comments section below. If you enjoyed this video and want to hear from me again, be sure to hit that subscribe button before you go. Thanks for watching.